starting off, which countries were part of the contributions, and was anything new revealed by them? And before you get there, why was this report done?
Yeah, thank you. So this report, Born Too Soon, talks about a universal problem, both in rich and low-income countries. So babies who are born preterm, before 37 weeks of gestation. And that affects 13.4 million babies every year. So part of the reason we had this big team is twofold. First of all, this big problem, which is at the top of the burden of disease and really robbing families all over the world, hasn't changed in the last decade, and we need to change it. And really exciting to see the collaboration that came together. We had the Director General of WHO leading the opening part of this journal supplement and speaking on the launch last week. And as you say, 95 authors from almost 30 countries on every continent, including South Africa. And across those, we have really two different aspects of learning. So we have case studies from 13 countries on every continent that are making progress. And we also have family stories from 9 different countries. And you're asking, who can we learn from? So I would pick 2 out of that. So India, over the last 10 years, has doubled their rate of progress for newborns surviving. And they've done that by India's own government investing in neonatal care. So 10 years ago, they had less than 100 neonatal units in the country. Now they have more than 1,000, and the Indian government are spending about $1 billion a year on that. So one of the things we highlight is this need for leadership. And I would also highlight another country, Tanzania, where I'm sitting at the moment. So this is a country that's in the top 5 for numbers of preterm births around the world and hasn't been making progress. But the female president here, Her Excellency Samia Hussein, has really taken a personal interest in preterm birth. And the country is building more neonatal units, looking at how to have more nurses. So I think that's something that we could copy right across Africa.
Now, just looking at a country like Tanzania, what sort of steps do they take to make the progress? You've touched on the nursing staff. You've touched on different aspects of staffing to ensure that, they come out from being among the top 5 in the world where there is a crisis when it comes to preterm birth. How do they get it right?
Yeah, thanks. And that's something we've tried to be very practical about in these papers, what is needed. So for these 13.4 million pregnancies, so both the woman and the baby affected, that happen every year, we need 2 big things. One is to do better on prevention. So that's about the health of women, care of women who are pregnant, not having too many teenage pregnancies, looking at infections in pregnancy and women's rights as well. And then the place where we can have the biggest impact at the moment is better care of those vulnerable preterm babies. And there, it's not like just dropping one injection from the sky. We have to be able to keep these babies warm, support their breathing. They're very vulnerable to infections. So we actually need neonatal care wards. And I think the thing that's been transformative and particularly impressive in Tanzania is having one coordinated plan. So looking across the country to say they have 27 regions, how many of those have a hospital that can really lead better care in that region? And then they need 146 new district hospitals. So this is a really big jump. So learning on how to do that. So let's not waste having 146 architects. Let's have a standard floor plan. So for those who are interested, you can go to www.newborntoolkit.org and download floor plans, nurse training, so that we're not wasting time by repeating those learnings each time. And then here in Tanzania, with that coordinated plan for 146 hospitals and what the gap is, both for space and for staff and for stuff to make it work, having one plan means that different funders in the government or other donors can work together to go faster. And it's such a privilege to see that happening here in Tanzania.
Let's talk about conflict areas, Prof, and how the marginalized populations have been impacted.
Yeah, that's so important. And we see every day on the news heartbreak for what's happening, in the Middle East and in many continents, and also across Africa. South Sudan, I was born just over the border, getting
All right, we seem to have, there she is.
Children
the
are
professor's back. Prof, we lost you there for a second. Please just start where you were born, just across the border.
Yeah, yes, I was saying we have so many places across Africa with conflict and fragile contexts that aren't getting attention, such as South Sudan. So around the world, 1 in 10 of the world's preterm babies are born in conflict settings, and they also often face climate threats and other threats. And in those contexts, the most vulnerable person are these tiny preterm babies, maybe a kilo, and really needing support and care. And this is something that is crucial. And in the series of papers with Born Too Soon, we have a very practical checklist of things that can be done even in these conflict settings to protect these vulnerable babies.
Now, looking at the focus that is on human rights law, it is the first time that this is happening when it comes to preterm births and a strategy being put in place, and it's just about laying the groundwork and implementation. How important is this to reduce preterm births?
Yeah, thank you for that. And, I learned so much when I was in South Africa about HIV and AIDS movement. And what was really critical there is the rights. Why should somebody who has HIV or AIDS in South Africa die when people in other countries were getting treatment? And we haven't applied that for vulnerable babies. And in many ways, also women's rights are under threat. So taking the human rights instruments and saying that every newborn, everywhere, even the most vulnerable, should have a right to have basic care, to survive, and also to thrive, and to see how we do that. And in this day and age where many rights are under threat, and indeed with a lot of donor funding, the news yesterday suggests that maybe 14 million extra deaths will happen because of USAID donor funding. It's really critical that we stand up for the most vulnerable and find ways to make sure that their rights are met wherever they are.
Well, Prof, it has been a pleasure chatting to you about this, and thank you so much for making time to chat to us.
And thank you for covering it and for all that you do. It's much appreciated.
So much, Prof. That's Professor Joy Lawn, a lead author of the report and a professor of maternal, reproductive and child health at the London School of Hygiene and Tropical Medicine, joining us on the line. It is 12:53 Central African Time, and we're coming to you live from Johannesburg in South Africa.